Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we are continuing on with our Slow the Aging process. And what about, are you worried about type 2 diabetes? So today I have Laurie Quiroz here with me. She is a TMC Diabetes Educator. Welcome, Laurie. Thanks for being here.
Good morning. Thank you for having me.
So, Laurie, you're going to be talking all about what everyone needs to know about type 2 this morning. You may be watching us on our YouTube channel or on our Facebook page. So please feel free to leave any questions for Laurie for after the presentation in the chat, and we'll address those afterwards. So, Laurie, I'm going to go ahead and hand this over to you so that you can get started.
Okay, thank you so much, Maya. Good morning, everyone. My name is Laurie, and I am an inpatient diabetes educator at Tucson Medical Center. I was asked to do this presentation to maybe give you guys a little bit more information about what is diabetes. So there are a couple different stages that you have. There's pre-diabetes. For our younger women, there's gestational diabetes, and both pre-diabetes and gestational diabetes can lead into type 2. And then there's type 1 diabetes. Pre-diabetes, it's basically the glucose levels are too high to be considered normal, but they don't quite meet the criteria for diabetes. It's usually associated with obesity, higher cholesterol levels, high blood pressure, and some of those are all factors that help lead to diabetes and sometimes cardiovascular disease. It's usually diagnosed by an elevated hemoglobin A1C or an impaired fasting glucose. So maybe your numbers are higher than the normal level, but not quite into diabetes. And for gestational, it's sometimes an oral glucose tolerance test. The most effective treatment is diet and exercise. Usually a weight loss of about 5 to 7% will help prevent the progression of the disease in most patients. Usually when you're at this point, your body's been compensating for around 5 years by the time you're actually diagnosed with it. Gestational diabetes is for our younger women. It's a condition which the carbohydrate intolerance develops during the pregnancy itself. It's usually diagnosed in the second or third trimester because of the increase in the insulin antagonist hormone levels resulting in insulin resistance. It's usually diagnosed with the oral glucose test that should take about 24 weeks. And the majority of women with GDM usually return to normal levels after the delivery. However, it can stay with you and you develop the type 2 diabetes after birth. Type 1 diabetes we used to associate mostly with kids. However, adults can get this. It's an autoimmune disease which occurs when a person's pancreas basically stops producing insulin. It's caused when the beta cells are mistakenly destroyed by the immune system itself. The cause of the attack is unfortunately not really known. However, scientists do believe that the cause may have a genetic or even an environmental components. People with type 1 diabetes are dependent on insulin. Otherwise, we can get ketoacidosis, and if the ketoacidosis gets really bad, even death. This usually accounts for about 5 to 10% of most diagnosis of diabetes. Type 2 diabetes. Most people are familiar with type 2 diabetes, especially those that are more mature. It's a condition in which the body does not use the insulin properly. We produce it, but it's not used efficiently. At first, the body actually produces extra insulin, but over time it slows down and eventually can even stop producing it the longer you've had it. It's usually associated with genetic diseases, the risk for development. Disease increases with age, obesity, and lack of physical activity. So the older we are, we just don't work as efficiently, unfortunately. It is also associated with an increased risk for heart disease and complications for diabetes. I guess you could call it the micro and macrovascular complications. So issues with your eyes, issues with your nerves, issues with your kidneys, things that we associate as complications of diabetes. Now, this accounts for actually 90 to 95% of most people diagnosed with diabetes. What are some of your risk factors? For prediabetes and type 2 diabetes, we talked about being overweight. Our ethnicity can play a part in it, especially the family history of diabetes. If your mom had it, if your dad had it, it makes you a higher risk. If you've had the history, gestational diabetes, that can definitely help promote it to you. Sedentary lifestyle. I think we're all a little bit guilty of that one. And then as we get more mature, older age. People aren't as familiar with something called GLADA. It's a definition of a disorder in which despite the presence of the actual antibodies for the diabetes, it's a progression of an autoimmune B cell, which actually eventually slows and fails. It closely resembles type 1, but it's most commonly misdiagnosed as a type 2 diabetes. It's a very slow destruction of the B cell function, can take up to 12 years to develop, and it accounts for about 10% of our type 1 diabetics who appear as type 2, usually 35 years and older. I kept mentioning complications. These are some of the complications associated with diabetes. Coronary artery disease, retinopathy, basically vision loss, neuropathy, that burning and tingling sensation that goes on in your legs, cerebral vascular accident, gastroparesis. Gastroparesis is where your stomach, the nerves in your stomach eventually don't digest the way that they should, so food can actually stay in your stomach for a long period of time. Peripheral artery disease. That's where your legs and hands, they don't get as much blood circulation. You can do medical nutrition therapy, which helps blood glucose levels maintain in a normal range or as close to normal as possible. The goal is 80 to 130. Sometimes they'll have you check after your blood sugar and after your meal. And at that point, it's 2 hours after your meal. You want to be 180 or less. And those that are sometimes on insulin, we definitely want to make sure your blood sugar is around 110 to 150. This helps prevent or slow the rate of the chronic complications that we just discussed. Now, each person is individual in what they need, so it does take into account your cultural and personal preferences. So sometimes you might want to get with a medical nutritionist to help you with that. It does sometimes limit your food choices, but we still want you to be able to enjoy what you're eating. It is very important that you monitor the blood sugars, okay? We have to self-monitor. For a person who is type 1, they have to do at least 4 times a day. Type 2s, depending on the type of medication you're on, if you're just on pills, you might be able to get away with 1 to 2 times a day. But if you're on insulin, at least 2 to 4 times a day. The ideal A1C that we're looking for is 7% or less, as long as you're not experiencing low blood sugars. Now, it's going to be individualized per person based on your health issues or your age. So here's some of your diagnosis levels. A fasting glucose of 100 to 125, 2 hours after 140 to 199, and an A1C, this is pre-diabetes, of 5.7 to 6.4. Once you have diabetes, you'll have sometimes diagnose you at greater than 126, a random blood sugar, or 2 hours after you eat, 200 or less, and an A1C of 6.5 or higher. Gestational diabetes, we're actually a little bit more stringent or strict because we got to think of both the baby and the mother. So sometimes our fasting is 92. An hour afterwards, they actually check a little bit more, 180 or less, in 2 hours, 153 or less. So everyone's like, I don't want to go on a diet. We understand that. So we keep that in mind. And what we do is we give you what we call a carbohydrate counting or carbohydrate consistent diet. We recommend usually about 60 grams of carbs per meal. So we give you an idea of approximate 15 gram serving sizes to help make it easier so you can still enjoy the foods that you like. You can also use the plate method, where half of your plate is vegetables, a quarter of it is protein, and a quarter of it is starchy or considered carbohydrates. It helps control the portions and makes it easier on your blood sugars. Everyone loves to hear this. Exercise. What happens when you exercise, and the reason why we ask for you to do that is because it increases your insulin sensitivity. Your cells are more receptive to the insulin. It also increases your HDL and decreases your LDL and your triglycerides. It also helps decrease your factors for coronary artery disease, and it helps in controlling your blood pressure. And it helps with strength and physical capacity, okay? We all need a little bit extra strength sometimes. It is recommended that we do 3 to 5 times a week, at least half an hour, but up to 60 minutes or more, especially if we're trying to lose a little bit of weight. The goal, remember, everyone here is 10,000 steps a day, so that does include this. Now, someone who has diabetes, we worry about something called hypoglycemia or low blood sugars. And this is where the blood sugar drops below 70. What can cause this is a delay in your meal. Maybe we didn't eat enough carbohydrates, or maybe we didn't have a snack. Sometimes maybe we gave a little more insulin than they had planned, or maybe you worked out more in the yard, or played around with the kids more, or something along those lines to increase your activity. And that can cause a low blood sugar. Especially with our type 1s, if we have alcohol without food, it can affect our blood sugars and make you drop. Or maybe we had a little bit of alcohol on our finger when we did a finger stick, and that can definitely affect it. Maybe you think it's either lower or higher. So the rule that we call it is the rule of 15. We want 15 grams of carbs. We're going to wait 15 minutes and then check it again. Some examples of carbs would be half a glass of juice, half a glass of regular soda. My favorite's the little fun packs of Skittles like we give out at Halloween. Those are perfect for about 15 grams of carbs. So then you'd wait the 15 minutes and then check your blood sugar again. Once you have reached 70 and above, you need to follow up with a snack or a meal, okay? When I'm talking about a snack or a meal, you need to have 15 grams of carbs again, along with a protein. Cheese, peanut butter, nuts, eggs, something that has a protein in it, okay? Now, if you have lows, you definitely have highs, and we're usually more familiar with the high blood sugars. We're always talking about high blood sugars. So the American Diabetes Association says basically 250 and higher, which can lead us, for especially our type 1s, into diabetic ketoacidosis. That's what that DKA is. And what can cause that is usually not enough insulin. Maybe we overindulged on our foods. We haven't been exercising enough. Maybe we haven't been taking our meds just in general, or especially now, cold and flu season, gets sick, or also the holidays, stress. So the biggest thing that you can do is make sure you're drinking plenty of water and taking insulin or taking your medications, okay? Signs and symptoms of high blood sugar is lightheadedness, dizziness, headache, usually in the beginning, but as it gets higher, you just become very, very thirsty all the time. And if you're thirsty all the time, you're drinking a lot. And if you're drinking a lot, you're probably going to the restroom a lot. So is it dehydration or is it high blood sugars? The only way to really know is to check your blood sugars. Different types of medications out there depends on the type of diabetes that you have. There's oral medications, there are injectable insulins that are not insulin, and then there's actual insulin. Some of the oral medications that we talk about, most people are familiar with metformin. Then people have heard of glipizide, glipiride, glyburide. Now the new ones that are out right now is Invokana, Farxiga, Jardiance. Some people may have also heard of Januvia, Onglyza, Actos, and Avandia. Those are some of the older medications that we have out there. Preclose and Glycet, Prandian and Starlix, we don't see that much anymore. And definitely Acarbose and Miglidolol, we don't see that one as much. Any questions?
Thanks, Laurie. So I do have a question. I wanted to find out more about type 2 being reversible. So what are the opportunities, or is that possible for somebody if they do have type 2 diabetes? Can they reverse that?
I have heard a lot about this recently, where they're saying it's reversible. It can go into a type of remission, okay, where you can, if you lose the body weight, you're watching what you eat. Some people even have surgeries. They can do that to help reverse the diabetes, as they call it. So even though you may have gone into a remission or reverse the diabetes, it's still, you have a higher chance as you get older to come back into it. So, but you can have quite a few years where you're not taking any medication, just controlling it with diet and exercise.
Okay. And is it true that eating too much sugar can cause type 2 diabetes?
Not so much that, it's more a genetic type of thing where our body's already predisposed to it. Does it help? No. Doesn't help. But I mean, if you sit there and have a bag of peanut M&Ms one time, it's not going to send you into diabetes.
Okay. Do you have to take medications for the rest of your life when you're diagnosed, or not necessarily?
Once you're diagnosed, once again, I said you can kind of go into what we call a remission with diet, exercise. However, once you're diagnosed, as you mature, you more than likely will be on medication.
Okay. Now, I remember my father had been diagnosed at one point with type 2 diabetes, and he traveled a lot. And so, how do you handle type 2 diabetes when you are eating out? If that's your only option, what are the best things then to look for when you're eating out at a restaurant?
That's a good question,
you don't
actually.
have the same accessibility sometimes,
Yeah,
as you would in your home.
That's definitely a good question. Everyone likes to eat out, especially with the holidays, if we're traveling or things along those lines. So basically a good rule of thumb is more vegetables, of course. If you're going to eat out, probably, especially here in the United States, we have large portions. Okay, so if we have these really large portions, if possible, cut it in half. Have half now and maybe half later. Okay, or share a meal. Yeah, share a meal. Do that as well. Also, there are some, for those of you that are pretty tech savvy, we have some apps out there that help you make healthier choices when you do eat out, help you count your carbs, things along those lines. So there are ways of eating out and eating a little bit healthier. Okay, now we still want to be able to go out with our friends and our family and do things like that. So just work with it.
Right. And so it's really just about making the right choices.
Yeah.
Are you
going to be perfect? No, no one's perfect.
No. And I know it can be done. I've seen I've seen that happen, and it's worked really well. But it is hard in the beginning, I think, for anybody that, is going out and you're trying to make those decisions. So
it's frustrating. It can be very frustrating.
Especially, but it sounds like if you have an app that maybe would help you to keep track, that might be a good way to ensure that you're meeting all of those goals. So,
okay. And actually, one of our classes does, I believe, provide an app and a booklet, I believe, if it's attended. So
okay, great. If somebody was interested, we do offer the Journey for Control class, which is a 4-week pre-diabetes class. Here at TMC for seniors. It is currently running on Zoom, and the next one starts in January. So we'd be happy to sign anyone up that may be pre-diabetic as well. It's a 4-week, 2 hours a week session that people can attend. So that might be another thing for more education. Laurie, I want to thank you so much for being here today and sharing all about type 2 diabetes and sort of what to watch out for and what those pitfalls are. So thank you so much for being here. We will be back tomorrow. Tomorrow we have our Whip It Up cooking class for the holidays. So please join us. We'll be with Chef Donna Norden at 10 a.m. Right here on Facebook and YouTube. So thank you all again. Take care.
Thank you, Maya.